Advanced surgical robotics is rapidly transforming the way procedures are performed, bringing greater precision, improving patient outcomes, and and bringing in new efficiencies in the operating rooms worldwide. At the same time, the sector is witnessing accelerated growth driven by innovations in imaging, the use of minimally invasive techniques, deployment of technologies such as AI, and their expansion across not just the developed markets but also the emerging markets.
Conditional autonomy introduces the decision support capability into the surgical robot. For instance, we have robotic bronchoscopy systems which are suggesting navigational pathways and the best possible targeting options to the surgeon, whereas it is the surgeon who is supervising and validating the final decision. So an example of this is the iron robotic bronchoscopy by Intuitive Surgical again.
Surgical robotics is moving towards smaller, more modular platforms, more integrated workflows, and higher instrument precision, all of which will eventually reduce setup time, improve efficiency of surgeons, improve consistency across procedures, and obviously expand into new therapy areas or new procedures.
What neurosurgeons used to do back in the days, they would open the skull, which is of course effective but incredibly dangerous. And this is why in the 90s they introduced this minimally invasive approaches, the equivalent to laparoscopy, but for the brain, where you can now gain access deep within the skull through natural orifices like the eyes or the nose or tiny incisions on the head.
Now, in the last decade, I think robotic has picked up drastically. Like we see a big shift towards robotic, and there is more adoption towards robotic surgery. And in robotic also, I think I did mention that in robotics also there's too much of and too many things that are advancing day by day. We are adding AI layers, we are making the surgery borderless, we are trying to add telesurgery and trying to make the healthcare and surgery more accessible.